In the tapestry of life, where every thread holds a story, America in Black and White emerges as a haven for the voices echoing through the heart of our communities. In this podcast, we wade through the rivers of our collective experiences, celebrating the vibrant hues of change brought forth by the whispers of hope and the roars of action. It's more than just a conversation. It's a journey into the heart of our society, illuminated by the light of those daring to dream and do. Join us, and let your voice be the melody that guides us toward a dawn where every color finds its place in the masterpiece of our shared destiny. Together, let's paint a future brimming with the positives that dwell in our minds and the actions that shape our world.
Good evening, ladies and gentlemen, and welcome to another episode of America in Black and White, where we are coloring conversations on the canvas of America. Tonight, we have a very special guest for you. We've got Mr. Denford Galloway. Denford Galloway was born January 3rd, 1961 in Memphis, Tennessee. Denford has seven living siblings. Denford is African American and has been living with HIV since December 5th, 2003. Denford is currently the Planning Council Manager with the Shelby County Health Department Ryan White Program for Memphis TGA. Denford has a certification in substance abuse counseling and is a volunteer mental illness teacher for the National Alliance of Mental Illnesses, NAMI. Denford is also a veteran who served in the U.S. Army. Ladies and gentlemen, I bring to the show Mr. Denford Galloway. Hello, sir. How are you?
Oh, great, Charles. How you doing today?
I'm doing just excellent, and thank you for being with us this evening.
Oh, my pleasure.
Is there anything you'd like to add to your bio before we get into the show?
No, I think you covered it mighty well.
Okay. Well, I like to start with the work you do as a planning council manager with Shelby County Health Department there in Memphis. Can you describe your responsibilities as the planning council manager at the Shelby County Health Department?
Yes, Charles. First and foremost, let me say my job is my life. As you said earlier, I've been living with HIV just about 22 years. So
Uh-huh.
basically, as a planning council manager for the Memphis TJ Ryan White, basically I oversee committees that decide how the service categories are prioritized. When I say service categories, I mean the service that the people living with HIV receive to help them stay alive and whole. So we have to prioritize those service categories, and we have to set funding to them. That funding comes from HRSA, which is in Washington, D.C. So those are the main duties. We do other things like outreach and go out and educate the community on how to not contract HIV and to make sure they know how to prevent uh, prevention measures to help them stay alive and not contract HIV.
Oh, wow. So when you guys go out into the community and how you do your outreach, is this one of the things that, that, shall I say, you guys are primarily like a federally government program that primarily focus on HIV, or do you primarily focus on many, many things that when it deals with public health?
Okay. Well, our main focus, Ryan White, is basically HIV. Actually, Ryan White was a real person, but that's a story for another day. But yes, our main focus is HIV and the prevention of HIV.
Okay. So what initiatives are you currently working on at the AIM on that aim to address health disparities in Memphis?
Well, especially with HIV, our main goal is to stop the HIV spread. But the disparity, of course, in our community, which is Black community, is great, Charles. We talking about the stigma involved surrounding that keeping people from wanting to get into care and get tested. Also, when we talking about disparities, we talking about people that don't have transportation to get to these appointments or transportation to go get tested and those type of things. And not only that, disparity, we going to take it all the way back to housing. Okay,
Hmm.
when there's a lack of housing for people that's has that disparity and can't afford housing, then how may I say this? Being and knowing your HIV status is not your main priority. Okay, when you
Right.
don't have housing, you that's your main priority. Think about a place to live and get off the street. So when you talking about dealing with HIV and someone that has HIV, first of all, you don't want to live with someone else that don't even know that you are living with HIV, because HIV is not a virus that people are fun to share about, to tell, hey, I got HIV. That's not something that you want to do. So therefore, if you living with someone else, you trying to hide your medicine, or you don't want those people to know, okay? Or if you don't have a place to stay and you stand in a shelter, you don't want people to know. So housing is the biggest disparity amongst those people living with HIV. And again, you talking about being able to get to your appointments to get those needs met. So
So
those,
when we talk about these disparities, can you tell us is this primarily what like the target would be, like the underserved and marginalized communities, where primarily these are the people that's lacking those resources, or the people that you guys target in that initiative?
yes, those are the people we're talking about, and not only that, just housing just not the only thing you talking about. It can go back as far as not having enough finances in your household to do certain things, uh, which leads to people going out to take certain risk, okay, risky
Mhm.
behaviors and things. It goes back to that as well. When you don't have certain things, it causes you to do a lot of things that you wouldn't do had you had those uh, resources in your life, had you had insurance to maybe go in and take care of these other health issues. It
Mhm.
wouldn't lead you to do certain things in life. So I think as a black community, we starting off behind the eight ball, uh,
Mhm.
from as compared to our counterparts. We don't
Mhm.
have the things and the resources or the finances that they have to get put us in a better place in life.
So let me ask you this. As we talk about, the underserved and marginalized communities, when you mentioned like these cases, especially like the newer cases or the newer infections that are happening, what is a guesstimated number, or how is that rate that's affecting the underserved and marginalized communities?
Well, that rate, first of all, as we look at it, of course, Memphis, where I'm at right now, is number two in the nation new HIV cases. And
Hmm.
yes, it does affect our community the most, the marginalized community, and it affects our teenagers and black women. Uh,
Hmm.
so you're talking about not having the resources, not having the education to know how to prevent these things, not having the financial resource to be able to get those prevention items like PrEP and PEP, things that help uh, keep people from contracting HIV. So you're talking about not being able to have transportation to get to uh, the health facilities that offer those things to help people stay HIV
Hmm.
negative instead of positive. So
Right.
when you talk put all that together and put we live in the high risk neighborhoods where HIV is contracted the most, uh,
Hmm.
it makes it a lot easier for the rate to go up in our communities.
Oh, wow. So, how do you guys prioritize the health needs of different communities within Shelby County?
We prioritize it by, first of all, going to those high risk areas which affects us, which we live in. Also going to the HBCUs and educating our students who are going, teenagers and students who are going to be making decisions for our country in the very near future. So we prioritize those by going to those areas and help educating them and help maybe fill the gaps uh, of those marginalized community where they would normally get it. So that's what we concentrate most of our efforts on in those areas.
Okay. So, what are some of the most significant health challenges facing the Black community in Memphis today?
Significant health challenge that facing the Black community, I would have to say, of course, dealing with high blood pressure and diabetes, those things are health challenges. But again, when you're talking about being able to get those health challenges met, we talking about we don't have the insurance. We don't have the insurance to make sure people can get seen on a regular basis to make sure they are not uh, contracting certain things, certain STIs. And sometimes a lot of people may not even know this, Charles, that the gateway to HIV is those other STIs from syphilis, gonorrhea, chlamydia, those things are gateways to that. So to be able to help them not contract them STIs and are the biggest barrier and the biggest priority to stopping HIV.
Okay, and so I want to apologize to our audience because actually, like we're going through this little storm, so it's kind of like it's messing up our connection a little bit. But so when you talk about those STIs, can you tell us if there are any new STIs that are out there that the public is not familiar with right now?
Not to my knowledge, Charles. Like I said, the STIs is not my major focus. To be honest with you, my major focus is HIV. That's the field. That's what Round White covers. HIV. So we don't concentrate on STIs on a daily basis, even though we run across it. But we have a totally different department that deals with HIV. That STIs. It just so happens sometimes we cross paths. But as far as I know, it's not any new. Uh, STIs that's out there.
Okay. So, how do you engage with local stakeholders to develop effective health strategies?
Well, first and foremost, other local stakeholders, we have like 18 sub recipients that we contract with to help spread the message and help provide service. As I said earlier, we are a TGA, meaning that we actually provide service to 3 states, 8 counties. So we try to strategically, with very good intentions, have providers, sub-recipients, as we call them, in certain areas of town, so it won't be a big barrier on getting to somewhere close to that provider or stakeholders to help provide those resources that the general public need to try to help curb those STIs and HIV. Still with me, Charles? Or whether the connection must have went bad on you. Okay, if you all can hear us out there, Charles having some technical difficulty at the time because of weather. So give us a moment here, come back in. Okay, Charles, you back
Okay.
with us?
Yes, sir. Can you go through that one more time? I apologize.
Okay. Yes, as I was saying, Charles, you was asking about stakeholders, and I was planning to let you know that as Ryan White recipient office, we have 18 others stakeholders slash, as we call them, sub-recipient. And as I mentioned earlier, uh, we are a Memphis TJ, mean transitional grant area. That grant covers 3 states, 8 counties. So we
Mm.
try strategically with intentions, put certain service providers in certain parts of town where those people that's affected, they need that service, won't have to go very far to meet those service costs. That could be one of the biggest barriers on not having a service provider close to you to go get treatment and resources.
Oh, wow. That's interesting. So normally, what is like the turnout when you have the people doing the community outreach to get people to come and learn about HIV, the services, the treatments, and things of that nature? What is normally what the turnout looks like?
Well, the turnout is great. Often is great. We do events like the Southern Heritage Classic, which is a big sports event, football event. If you ever heard of it in Memphis, Tennessee, we go
Yeah.
out to back to school health fair. We go to HBCUs, and we do whatever we can to get the people engaged and get them to participate by getting tested. We offer any incentives we have to offer, well, not any, but we offer incentives like gift cards or what have you. We feed the community. We have to. We even collaborate with big churches. Church of God in Christ here in Memphis have um, Christmas in November event where thousands of people come out. So we get the opportunity to educate those people. We get the opportunity to have HIV testing during those events. So a lot of time we have large crowds. Like I said, we have big events. We just did an event this past weekend called the Tri-State Black Pride,
Hmm.
where we actually tabled, educate the community, and did whatever testing we can do.
Okay. Can you discuss the importance of community outreach in your role?
Well, the importance is very great. It's very important that we get out and meet the community where they're at because they're not going to come to us. Okay.
Mhm.
First and foremost, working for a health department has a great amount of stigma on it because no one wants to be seen going to the health department because they know, hey, if you go to the health department, you must be going to get treated for some STIs or HIV, da da da. So the health departments everywhere has a great amount of stigma on it. So therefore, going out to meet the people where they're at because nobody wants to go to an entity where it's known that they treat people there for HIV. So you don't want to be seen walking into those buildings. So we try to make it easier for the general community and the public to not have those barriers and not worry about being stigmatized by going to a place or not having a friend or family member say, hey, we seen you go inside thus and such place where they actually treat people for HIV or STI. So that is our main goal, meeting people where they're at.
So let me ask you this, because that in itself, you said a term that I know that most people with HIV have dealt with this or feel this way. That term stigma.
Hmm.
When you guys go out and you're doing this outreach, and maybe when you're doing some counseling and so forth, I mean, what are the percentages of people that you guys run across that mention the stigma and how they felt before maybe they got treated or was preventing them from getting the treatments they need all the time?
Wow, you asked that question, and I'm about to go into a little something that may shock you. But yeah, stigma is a real thing, and sometimes it's just internalized stigma, meaning that hey, okay, I'm living with HIV, and I'm worried about what people thinking about me, and they may not be thinking about me or thinking about my HIV status. Of course, HIV is not it's a scary situation, but when we talk about stigma. Again, if you seen going into that place, somebody gonna stigmatize you and say, "Hey, you must be HIV." Used to HIV was a gay white male disease, okay, or gay white male virus, if I may use a softer term.
Mhm.
So I'm not gay or white, so
Mhm.
it affects everybody, okay. Um,
Mhm.
so you talking about living with something and trying to get the community to get tested when they worried about being stigmatized. And not only being stigmatized, there's a criminal HIV criminalization law saying that hey, if you know you're HIV and don't disclose that, you can be put on a sex arrested, put on a sex register. Okay. I've
Mhm.
had people tell me that hey, I don't want to know when I ask them about getting tested. I don't want to know and for numerous reasons they may not want to know. For not wanting the stress, having to live with the stress of saying, "Hey, I'm gonna be stigmatized. I could possibly die if I don't take care of myself." Yeah, yeah. Everybody always say yeah, but HIV is no longer a death sentence. Correct
Mhm.
in a sense, Charles. But if you don't get tested and know your HIV status, it will become a death
Mhm.
sentence. You will die from it. I'm not gonna sugarcoat it. Uh,
Right.
uh, Getting tested, knowing your status, and getting into care are the things you need to do. But yes, you have a lot of people that don't want to know their HIV status, don't want to find out, but fear of the stress, depression that could be involved. and knowing that you're dealing with something.
Well, and that's my follow-up question to that is normally when you guys meet those kind of people, what is their mental status? How are they like in the mind, trying to not think about the stress or knowing that it's a stressful situation? What is the mental situation like for a lot of those patients or clients?
Well, let me speak about myself, Charles. Let me use the I statement on you. uh, I haven't always been able to be in the position I am now to talk about my life or living with
Mhm,
HIV. I haven't always been there. Okay, there was a time in my life when I first contracted HIV that I was going through depression,
mhm,
stress, even thought about suicide. Okay, and I'm not ashamed to say it. We have to be able to speak about it and talk about it to get past it. Okay,
mhm,
so those and I'm around a lot of people that's living with HIV. So I
mhm,
can tell you uh, that that is the mindset of a lot of people living with HIV, the stress, the depression, and the medicine affects everybody differently. I'm not a doctor, but the
mhm.
medicine, when I first started taking medicine, it affected me differently where, hey, I didn't feel like I could hold down a job. So
Oh,
that messes with you mentally, okay?
wow.
Yes, and when I say not being able to hold down a job, the medicine does something to you, okay?
Mhm,
Until you get used to your body, not automatically used to that medicine, okay? So,
mhm,
and I'm gonna even go a little further, Charles. We are in an era where they call it aging with HIV, meaning
mhm,
that they wasn't expecting us to live this long with HIV. Okay,
mhm,
wasn't expecting it. Matter of fact, we have the largest conference for HIV conference, which they call USCHA, United States Conference on HIV and AIDS. This year, Magic Johnson will be the headline speaker. Okay, and
mhm.
as you know, everybody know when he came out and announced it. And yes, he still do have HIV. He takes the same medicine that I take. So yes, he hadn't got rid of his, but because they wasn't expecting people living with HIV to be living this long, aging with HIV, it has become a big topic these days. And they're
Mhm.
actually having a conference this year, headliner Magic Johnson, to talk about that. So, but yes, HIV has a mental effect to it, and I often say during the meetings that we have and the people that stakeholders that don't just give me a pill and get me to a state of mind where they call U equals U. Undetectable mean untransmittable mean that if you on your medicine properly, you can get to a scientific state that if I'm U equals U, that I cannot transmit the virus. Okay,
Mhm.
that's scientifically speaking. That if I'm on my medicine become undetected, I cannot pass it. Okay,
Mhm.
but my mindset and my thought process to the powers that be that hey, don't just give me a pill, give me to U equals U. Deal with my holistic mind. Okay, because
Yeah.
living with HIV takes something from you.
Mhm.
So you need some mental help when you're dealing with HIV. And I'm not here asking for any sympathy. I'm here telling you the facts of life of someone that's living with HIV. So you have to deal with that holistic approach.
Let me just ask you this real quick. This a side note here.
Okay.
When is that conference and where is it located?
That comes from this year's in Washington, D.C., and this will be from September the 4th through September the 7th.
Okay. Okay, because I want to actually look at possibly trying to get there and actually cover that because that sounds like something that's really important. That I think just in looking at our different communities, that we need to put this out in as many ways as possible for people to get this information. That's why I was asking.
Yes, it is a very important conference. So, and it need to be covered and need to be shared, and people need to know. The more people know, the more uh, the spread of HIV can be stopped and eradicated.
So, what role does data play in your planning and decision making processes?
Well, actually, the data, good question. The data role plays, and me being a planning council manager, it plays a role in us determining how the federal grant money is awarded and allocated. Okay,
Mhm.
so and basically we actually get data. We do through needs assessment by every 3 years going out and doing surveys of people living with HIV to see what their needs and unmet needs are. Okay, so we
Mhm.
use that data to determine, okay, this is where the money is going to be placed. So that committee, the one who's actually decides and votes on which area or service that is needed the most.
Okay. And how do you measure the success of health programs you implement?
How do we measure success? Actually, we have a data person that does, I guess he called it performance measures to see how many units each person living with HIV use. They measure by the people that's undetectable as well, about being in care. They actually keep track of people that we engage into care and retain into care.
Hmm.
So those are two big areas performance measures that is tracked and go towards the data that we use, as opposed to how successful we are.
So, what has been your most rewarding experience in this position thus far?
My most rewarding experience, I would say, getting out talking to people and them appreciating our office, going out and educating them on how to keep from contracting HIV. Not only that, but being able to speak with our youth and to get them engaged and involved. That's not an easy thing these days, to be able to, especially someone my age, being able to communicate with the youth to get them to understand. But the third biggest one is being able to communicate with our school system, because it's a challenge getting the school system allow us to come and educate, because some of them think, okay, because you're talking about it, we condoning sexual activity. No, we're not. We're simply trying to educate, especially our youth, because if we don't, the streets will. So
Right,
we
exactly.
need to get there and educate them. So to be able to do that is rewarding.
Well, this is another thing that as to like how I've been looking at these situations, and looking at what's like new cases, and the areas in which they are and so forth. Now, I'm here in Metro Atlanta.
Mm-hmm.
So the thing that has been really, I call it stressful for me, is because I think it's nonsensical of these new cases that are popping up. But they're not just popping up, their populace is very, very high in the younger community. And so, I mean, like, with this reckless behavior, like, what are some of the things that you guys have been thinking about trying to do in your outreach to really reach a little bit more deeper into that pocket of the youth? What have you guys been doing more or trying to change?
Well, let me say this, especially here in Memphis, in our area, uh, out of being number two in the nation, it affects our youth the most from age 14 to 25, at school age,
Yeah.
as you well know. Some of the things we're trying to do is collaborate with, we have a entity called YCAB, the Youth uh, Community Consumer Advisory Board, trying to see what moves them, trying to see what uh, catches their attention the most. What would they look at on social media that they will actually pay attention to? Okay, a lot of times there's a barrier of ideals and what we do as an older generation versus what they do. Okay, so we
Right.
have to first and foremost find out how to reach them. The best way to reach them where they'll actually look at certain things and they retain it. Okay,
Hmm.
because we have sat down with quite a few youth and they'll tell, okay, if this that post is this way, we won't look at it. If it's that way, then we'll pay attention to it. So that's the first barrier we have to cross to get them to listen to what we got to say. and put it in a fashion where they are hearers and they'll receive it. Okay. So
Mhm.
that's our strategy as far as getting the youth involved and getting them to understand and be educated and keep them from contracting these things. Personally, I think there's not a lot of fear these days of especially HIV. And let me tell you why, Charles. I believe that
Mhm.
they look at it as to see, well, hey, well, if I do contract it, there's medicine. Of course, we have tried preaching abstinence. We have tried that, Charles. I think everybody know we have, and you have, and everybody else have. Nobody's hearing abstinence these days. To be honest, they're not hearing it. We can preach it and keep going that route, but they are not hearing it. So we try to do what we can. Even we have to preach proper use of a condom. We still
Mhm.
try to preach that, but the main thing we have to try to preach some of the newer methods of prevention from prep to pep or what have you. But
Mhm.
we have to try some innovative ways to reach our youth. Uh,
Mhm.
they not hearing the old ways. They want to do their own thing. They want to do things their own ways. So we try to challenge them to be involved more, to be at the table. I call it being the CEO of your own life. Hey, tell me what moves you the most. Tell me what you prefer to do or not do. So we try to apply them things to help them, helping them stay safe. Okay, not
Mhm.
just not talking about violence, but safe as far as sexual contact and sexual education, sexual wellness, as we try to put it. And we try to use that term more so, sexual wellness, because people really don't want to hear HIV, uh, or they really don't want to talk about that as a whole. So we have to try to use other terms like sexual wellness instead
Mhm.
of just HIV.
Oh, wow. So, how has your work at the health department evolved in response to the COVID-19 pandemic?
Well, Charles, everybody know how hard the COVID-19 pandemic hit us. We even had to do some readjustment as far as how we did work from telehealth. That was the main thing that we had to convert to telehealth. When COVID first hit at the end of 2019 to 2020, we had to do some readjusting. We had to start working from home. We had to make sure we were safe first to be able to help others. Because COVID-19 didn't spare no one, as you well
Mhm.
know, the healthcare field or what have you. So, of course, we had to still try to make our way and get into the office and do what we could do. But because of COVID-19, a lot of people living with HIV, or a lot of people that's at risk, could not make it to their doctor's office.
Mhm.
So, the best thing we could do was go to telehealth and still try to see as many people as we can to help them continue to be educated, continue to be served, continue to provide those resources that's necessary.
Mhm. So, let's do a transition, and let's transition over to hearing your story of you living with HIV.
Okay.
And can you tell us, how has living with HIV influenced your perspective on health and wellness?
It has influenced it greatly, and one of the ways it has influenced living with HIV caused me to say, well, hey, that's something else that could keep me from living alone. So first of all, let me start with my own personal life, my own body, my own health,
Hmm.
and which cost me, along with someone dear in my life, to help me start eating better.
Hmm.
That was the number one thing. Just change my diet, to change the
Hmm.
way I eat, to help me live long. I'm 64 right now. I feel like I'm 25, Charles, and I work just as many hours as anybody else.
You
Uh,
wearing it well.
well, thank you. And it's only because I've changed my way of eating. Uh,
Hmm.
Nobody wants to be on medicine all their life. I know
Yes.
what runs through my family as far as blood pressure, heart conditions, strokes, and things like that. So I knew I had to change something anyway. So that was the first step, and to living longer and having changing uh, my health. It's the way I eat, trying to be more active, trying to keep my cognitive mind more involved with things. And of course, my job helps me do that. To stay involved and be around people and see what they thinking, which helps me become wiser. So,
Mm. So for some people that are out in our audience that are HIV positive, and they're kind of like at crossroads where there's like lots of decisions to make, and they don't know which is the right decision and what decision to make and so forth. What is some advice that you can give them to help them to change their lives?
well, first and foremost, I'm encourage them. First and foremost, encourage them to stay in care, to continue to endure whatever depression they may go through, or get involved with support groups, someone like myself that can mentor them, to help them, to show them uh, what they need to do, and to be around people that's living the same life that they are living. But again, first and foremost, to stay in care, to continuously see their doctor too. And this is a very important thing, to don't be embarrassed to talk to someone, a therapist. I have two therapists. I don't mind sharing that, and it has helped me tremendously.
Mhm.
So those are some of the things that I would encourage people living with HIV to do: to get out and enjoy life, and to involved with support groups, and talk to a therapist, and to get some exercise in whenever possible.
And so, what misconceptions about HIV do you encounter most frequently?
Most misconception that I encounter is, I would say that people feel like maybe they contract HIV from you from ways that they can't contract it. I was sharing my story amongst a group of people one day at a community outreach, and when
Mhm.
I mentioned our HIV positive, a young lady, she must have jumped 10 feet away from me, and it
Oh
did.
my God, get out of
Yeah,
town.
that's the stigma involved around and HIV, and it didn't phase me because I knew everybody just do not know. And that's why our job is to go educate the community on how they can. And there's a lot more people have gone through a lot worse stigmas and situations than that. From I've heard stories from, hey, their family didn't want them to use the same silverware and they used it. We got them throw it out, throw it away, or what have you. So there are some horror stories. So yeah, people just do not know the full story about how you can and how you cannot contract HIV. So we try to get that message out.
So what can you share, or well, can you share any challenges you faced in managing your health as a person living with HIV?
Well, lately I haven't faced many, but when I first started this journey, taking the medicine, some of the medicine I had 4 or 5 pills, and all of them did not agree with me. So that was a big challenge for me to get past that stage. Okay. Uh, Not only that, from the beginning, you talking about the medicine changing the way your body felt, and getting past the mental aspect of living with HIV,
Mhm.
trying to hide it from people. Okay, so those was the biggest challenge that I faced earlier on. As of right now, I can say I'm not facing the challenge. I work a full-time job. Okay,
Mhm.
work more hours than most people half my age. Still
Mhm.
get around. Uh, wow. So I don't, for myself, but I'm one of a many. But there's a lot of people more than not that face a lot of challenges dealing with HIV. First of all, the mindset. And don't get me wrong, I'm not perfect. I still have a mindset sometimes where, hey, it stops me from being all I could be and all I want to be, just to
Mhm.
be honest with you. So, but for the most part, I'm doing great living with HIV.
Mhm. So, what advice would you give to someone who has just received an HIV diagnosis?
The two biggest, actually three, I'm gonna give you three. One is
Mhm.
get on in care on medicine as fast as you possibly can. Get into care once you get tested and find out you're positive. Get into care. Get engaged in the care with your service provider, whoever you may want that to be. The other thing is start going to support groups and find out how others has been living with HIV. Okay, and the other thing is talk to a therapist. Okay,
Mm,
talk to a therapist or get you a mentor or someone that's been living with it for a while and can show you the ropes and show you how to live with it and thrive. We call it thrive. Our
mhm.
slogan is know now, live longer, thrive. If you
Okay.
know, you live, and if you live, you can start thriving and have a good life.
So, how do you advocate for others living with HIV in your your professional and personal life?
And especially, let me start with profession. That is part of my job. Professional is to uh, be a leader, and I call it lead by example of people, the HIV community, as we call it, to first of all let them know, hey, if I can do it, you can do it. I'm 64, and if I could work every day of my life and can lead people and could advocate for people, you can do it as well. I'm actually involved with agency like NMAC. I go to these conferences and I learn from other people living with HIV from other jurisdictions and see what they doing to be important. I get involved with uh, being a member on other agencies, planning council, to see what they doing that's successful. So we talking about in a professional field, I do a whole lot to be around uh, ideas, topics that's best suited to help people living with HIVs thrive. Uh, Keeping up with what the government is doing as far as funding for people living with HIV, and everybody know where we at right now as far as funding and the cutbacks we're going through. So that's another whole thing to help have to keep people living with HIV in a positive light. Say, hey, we still fighting and we still gonna survive. We're still gonna thrive. We'll find another way, even if it's through private funding. But as far as personally in my personal life, advocating and teaching people, talk to my family, friends, or whoever, they all know I live with HIV. It's not a secret in my life anymore. So I would hope that they know that I live with HIV and knowing that issues had caused early on in my life, that they would do what they have to do to make sure they don't have to live the life that I'm living.
Mhm. So, in what ways do you think stigma around HIV can be reduced in the community?
Having conversations about it, talking about it. Um, that's the biggest thing. We got to have a conversation. We got to discuss it. We got to educate our community on how you can and can't, and who it affects and who it don't affect. Nobody is exempt. If
Mhm.
you don't know how to keep from contracting it, if you take those risky behaviors, then you can possibly catch HIV, especially if you're having sexual contact. But it's something that we got to talk about. We can't hide it no more, especially from our youth, especially in the school system. We even try to our best to partner with the faith-based community because we know a lot of people still grew up in that era where, hey, the faith-based community is everything, and that's where a lot of our education come from. That's where a lot of our leadership come from. That's where a lot of our guidance come from. So we
Mhm.
try to rely on partnering with the faith-based community. But yeah, we just got to talk about it. We got to get out in the streets. We got to be, and it starts with people like myself that's living with HIV, so they can know that, hey, it's real. I'm not doing this because it's a 9 to 5 job. I'm doing this because this is my life. I'm living this life. I'm telling you that it's real. It can be contracted, and you can have to go through living a life, living with HIV, which is not pretty.
Wow. So, how has your experience with HIV shaped your approach to public health?
Well, before contracting HIV,
Mhm.
I really didn't have a lot of interest in public health. To be honest
Mhm.
with you, of course, we all hear about going to the doctor for high blood pressure, diabetes, or what have you. But before I contracted HIV, I knew
Mhm.
nothing about Ron White.
Oh
Never
wow.
heard of it, never really considered HIV. None of
Mhm.
the stuff that I'm talking about today, it has nothing to do with my life. I felt like, well, hey, that ain't got nothing to do with me. And believe it or not, Charles, a lot of people today think that way. If it don't affect them, if they don't have family members or friends in this field or living that life affected by HIV, a lot of people have no idea what Ryan White is about. And I
Mhm.
can say that because just recently, a few months ago, I went to a rural community. They had no idea of what Ryan White was. So,
Oh wow. And so, are there any advocacy or particularly passionate about?
yes, they are. And those are just making sure people know their HIV status because
Mhm.
that is the beginning of it. That's the beginning phase. Yes, again, HIV is no longer a death sentence. But if you don't know your HIV status, it can be everything negative to you. And if you don't know your HIV status, it'll creep up on you and you're going to feel it. So that is where it starts at for me, getting people educated and knowing the HIV status.
Wow. So let's transition over to your military career as you are an Army veteran. Can you tell us what motivated you to join the military, and what branch, and why did you pick the Army?
Oh, wow. I'm smiling, Charles, because I've told this story many times as to why. I didn't even take ROTC in school. Uh, I could care at that point in time in my life could care less about the military or the army. Nothing negative, no issues. But the reason why I chose the military 12
Mhm.
days after high school because I
Mhm.
had a huge family. Okay,
Mhm.
and we lived in a two-bedroom, one-bath house with probably about 15 of us.
Mm.
Okay, so going into the military was the first time I slept in my own bed in my whole life.
Oh wow.
Not because I wanted to be a soldier or whatever. I needed a place to sleep on my own for the first time in my life. And if I had to do it over, I wouldn't dare change a thing because the military molded me, it shaped me, it disciplined me, it gave
Mhm.
me a sense of direction. So I
Mhm.
wouldn't change the thing in my life. But yeah, it's funny because the reason I went there was because I had never slept in my own bed.
Oh wow. That's definitely interesting.
Yes.
But I'm gonna tell you something. Now, one thing that you and I have in common with that is when I joined the Navy, I had never took ROTC and was
Hmm.
like just always had the craziest thing to say about it. But then out the blue, I joined the Navy,
Hmm.
right? And it was like a shocker to everybody. Was like, "You joining the military?"
Yep.
Yes.
We all got our
So
reasons.
yeah, but it was an eye opening experience. You're definitely right.
Right.
Can you tell us your military experience has shaped today?
Well, I think it shaped it greatly. Starting at the age of 18, I was put in charge of a unit while I was in South Korea at the age of 18. And I took the approach then, I wasn't a very vocal person. So I felt like I'll lead by example. So I'm a person that still believe in that style, leading by example. So hey, if the work to be done, I'm not gonna say, hey, you go do that, you go do. I'm gonna jump in first, and I'm gonna show them, not just exactly show them how it's done, show them that I'm willing to do the same thing I'm asking you to do. So when you lead people in that way, they gonna follow you because they gonna say, hey, well, he ain't too good to do it. Let me jump in and do it. So I still take that same approach. Yeah, I can be drill sergeant style if I need to be,
Mm-hmm.
but I prefer to lead by example. I prefer to do the same thing that I'm going to ask you to do.
Right.
And so it sound like you breaking up. The weather must be hitting you down.
Okay. Wait, did it come back in?
Yes, you back in pretty much.
Okay. Well, yeah, I was just
Yes,
saying
you
that
still got to look.
that's a pretty good way to lead, because it basically, if you're doing it and you can show that you're doing it and there's that example, you're right, a lot of people will follow. What lessons from your time in the army do you apply in your current role?
Well, one of the lessons what I just spoke of, leading by example. Sometimes I get looked at like, hey, you're doing too much. You should let your employees do that particular thing or do something that take something out of your hand. I even hear it from my daughter. Why don't you dedicate some of that to other people? Delegate rather some of that work to other people. I said, well, I will one day, but right now I feel like, well, hey, we all, it's not a shortage of work. So, especially where it's not a shortage of work, I need to pitch in and help too, because as we know, we are in a time where, hey, everybody's cutting back. So, I mean, all hands on deck is needed. So
Mhm.
that's why I try to approach uh, the situation that I'm in as far as my career concern. And of course, yes, I learned it from the military.
Mhm.
I always, and they get on me back. Wow, you get there an hour and a half early. Yes, if I'm doing outreach, I'm getting there to set up on time or whatever. I've always believed in being on time.
Mhm.
I'd rather be on time than to and be late. Even when I have to fly out, I'm at the airport 2.5 hours ahead of time.
Mhm.
So I learned those traits from the military.
Were there any specific experiences during your service that influenced your career path?
No, not really. I left the service and started in law enforcement. So I don't think the two had much to do with it. When I was in service out military, I basically dealt with communication, telecommunications.
Mhm.
So I don't think my military and my personal life career lines up with each other. And I tell a lot of people that go into college, I say, hey, you're going to start college in one major, but don't be ashamed to uh, go in another direction. You feel like that's the best course for you.
Mhm. So, how do you think military service impacts mental health, particularly in connection with civilian life?
Well, I think, far as military as to civilian life, I think everybody see different things in military
Mhm.
that could impact your mental health in certain ways. Even and I go back to I did, never did in wartime, but I sometimes go back to the simulated training that we had as far as POW camp.
Mhm.
Even though it wasn't real enemies, it was
Mhm.
situations that I went through that I still consider and think about. Being talked to a certain way, and that's a whole nother thing from the drill sergeant talking to you like you dirt until doing certain trainings, going through gas chambers and things of that nature. Even though it's friendly fire, they treated you like, hey, you was nothing, and they talk to you in a kind of way. Of course, being in the military, that's the way, I guess a form of discipline, but it's something that you do not forget, and it will shape your mental health from time to time. And I see you laughing because I know you know what I'm talking about if you ever been in the
Mhm.
military and had to go through basic training.
Mhm. Look at that, PTSD is real.
Yes, it is. Yes, it is. But hey, I think the good outweigh the bad.
Yeah. Can you reflect on how your service informs your understanding of health equity?
Well, I would say, in the military service, you got the things you need while you was in there. So therefore, you feel like, well, hey, okay, um, I, I'm getting an equal shake in what I deserve. I didn't see too much health disparity or a whole lot of unequalness. Of course, it don't mean that it wasn't there. It's
Hmm.
just that I wasn't exposed to it. But so I've seen the sides that okay, everybody gonna get the same treatment. Which one? I didn't say it was very great, good treatment, but everybody got the same quality of health service in the military, uh, from my perspective.
And so, as nothing, as our last conversation that you and I had, I was mentioning to you that we do Black History 365. And when I ask you who was the most influential person from Black history that influenced your career and your life, you mentioned Martin Luther King Jr. And can you tell us why do you consider Martin Luther King Jr. to be the most influential person in your life?
Well, because of course everybody know where he died at in Memphis, Tennessee, and I can recall being a very young child at that point in time. And if I remember nothing else in my life, I remember that day, April 4th, 1968, playing in the streets of Memphis, North Memphis, playing hide and go seek. And the only thing I can remember was the tanks coming up and down the street, letting everybody know to get off the street. So that day 4th, I'll always remember Dr. Martin Luther King and remember the speeches that he gave and going back and seeing that site where he was assassinated at. So he instantly became my hero, became the person that I wanted to follow and know about because he preached nonviolence, and I didn't hadn't seen violence in my life, so I felt like, well, hey, that's a good approach to try to bring people together and to be a good example, a good leader.
So, how has Dr. King's message of nonviolence resistance impacted your approach to social issues?
Well, I would say I definitely approve of that approach because I think you get more done with honey than vinegar. So rather than going out and I tell people, pick and choose your battles, even when you're done wrong. Or people have done you wrong, pick and choose your battle. You can't fight every battle, and you can't fight it all with a cast iron fist. Sometimes you have to be able to maneuver around certain things to get what you want and to get what's best for the entire community. You can't always you know, just yell and be violent because uh, I don't think it gets you anywhere. I think violence begets more violence. So
Hmm.
you talking about the best approach where less people are hurt is the nonviolent approach. I know sometimes we want to scream as loud as we can, and we want to knock some people down as low as we can knock them, but that only ends you up in more trouble. It only ends you costing you more money, taking you away from your family. So you talking about even if you right, if you take that nonviolent approach, you talking about maybe getting arrested, posting a bond, losing your job, paying attorney fees, and embarrassment. So I think that's a great approach, a godly approach.
So, in what ways do you see Dr. King's teachings reflected in your work today?
Well, I think it probably shaped me as well as to who I am, as to my personality. I was an introvert growing up, and even
Hmm.
though I talk more, I still believe in preaching, doing the right thing,
Hmm.
being the soft or forgiving person. So that is my approach to life. I don't care how bad I'm done, how wrong I'm treated, how many names they call me. I still believe in forgiveness and doing the right thing and taking that godly approach.
Can you share a particular quote or speech from Dr. King that resonates deeply with you?
I have a dream.
Mm.
I
I
have a
have a
dream.
And
That
so when you think
move.
about I Have a Dream, can you tell us like what about I Have a Dream that personifies and specifically says this is Denford?
Well, being able to get along with everybody, regardless of who they are, race, what have you, regardless of what gender they prefer. In today's world, we call it preferred pronouns, and regardless of who a person want to be, regardless of what we think about them, is to treat people with respect, treat people the way you want to be treated.
Mm-hmm.
So when we look back to Dr.
Mm-hmm.
Martin Luther King Jr., that's what he was about. He don't care whether or not uh, I agree with you personally. It's not for me to judge you based off who you decide you want to be. Who you want to be don't hurt me. So why shouldn't I respect you or allow you to be who you want to be? Or why should I challenge you on who you want to be?
Right.
So that's who I am. And I think a lot of that came from Dr. Martin Luther King Jr.
It did. It did. And so, can you tell us, how do you think Dr. King's legacy informs conversations about racial health disparities?
Repeat that for me again.
How do you think Dr. King's legacy informs conversations about racial health
Well,
disparities?
I think his legacy still resonates in a lot of people's mind about health disparity, even though they may not agree with it or want to agree with it publicly. They know that that's the right thing to do. They know that's right. When I say they, I
Hmm.
mean the powers that be that still fight those civil rights challenges. That still want to have more supremacy than the next group of people. But deep down, they know that's right, and that they should fight for it and implement his thought process because it will always be what is the best way for the people, for everyone equally. So I think his legacy still exists. It's still on people's mind. It's still something that we strive to do today. So his legacy have laid a foundation that would never disappear, or so it would go on forever. And I think every generation, no matter how young the generation get that's lead, I think
Hmm.
that's something that they always will fall back on. They're gonna always say, "Well, hey, we are all equal. We should all receive the same equal this, equal that, or whatever the topic may be. There's no one race any better than the other, and there's no one race that should receive anything different than the next race."
Have you participated in any events or initiatives that honor Dr. King's work?
You said, "Have I participated in any initiatives?"
Yes.
Uh, the
Any events or initiatives that honor Dr. King's work?
the only participation I have in some of the things that he has been part of was doing certain parts of the year when they have marches down at the Civil Right Lorraine Motel. Uh, I tried to participate in those and go down there and be involved in some of their marches.
How do you think young people today can best carry forward King's vision for equality?
I, I think the best way is to be registered to vote and go vote and be heard. Uh,
Hmm.
you got to be in a position where what you feel like is right, you got to be in a position to vote for it
Hmm.
because that's the way our uh, democratic process works. You got to be heard, and to be heard, you got to vote.
Hmm. So, just with that being said, and and you thinking about King and thinking about how you're leading one of the departments there for public health in that department of Memphis in Shelby County. What are some of the things that when you're doing your outreach, have you ever had that conversation with some young people about going to vote, or just in general, just speaking when having a conversation about people needing to go out to vote?
Yes, we on many occasions, and my main topic is not to try to persuade them to vote for any particular person, but to
Right.
be in a position to be registered to vote, to have your voice heard. So yeah, that's something that we do from time to time. Even some of my meetings, we'll take registration forms so people to fill out to make sure that they are registered to vote and to be heard.
Mhm. So, what specific examples can you give of how you've applied King's principles in your community work?
Well, I would say that letting everyone know that they have a right to all the service that's provided. I was just speaking earlier today to a group of people on uh, what you're entitled to. So I encourage them to come to our meetings, to our outreaches, or whatever else we have, to let them know that they are entitled to certain things. And even this spoken today, even if you don't want to be a member of my these committees that serve people living with HIV, at least come to these committee meetings to see what you're entitled to as a person living with HIV. So I think that goes along the same route. Hey, uh, you may be living with HIV, but you are this particular client, so you are entitled to these equal share of these, and not only just the people that's in the HIV community that I see every day, but everyone in other communities. Being when I say other community, mean Latinx, the Asian communities, and other communities, saying, "Hey, you are entitled to these equal share of this pie as well."
Mhm. Now, I actually, knew that this would be a really special show and a really good show. I added another part to this because, Denford, I think, what I think people have learned so far at this point about this interview is
Hmm.
that you have displayed more than just resilience and strength. You showed the willingness of what it is to go out and to help a community and help the community form and to build. And so I think a lot of people need to take that from you. But I want to ask you this because, just some personal reflections and, from a broader perspective. What do you believe are the most pressing health issues facing the Black community today?
Mm. Well, of course, we all know that silent killer, blood pressure, is one of the biggest things that's facing our black communities. Of course, we also have diabetes. Well, you know what? It's so many things that's facing our black community today, Charles, that
Mhm.
it's hard to say, hey, this one particular one is the most pressing. But yes, blood pressure and of course heart disease fall within that, but also diabetes as well. Those are some of the things that's actually um, is tops that's actually keeping us down, keeping us from being able to thrive as a community, as a race.
But now just something to just think about. Some contributing factors to that. Do you think that with the lack of resources in our communities, to where not being able to have the correct grocery stores in our communities, because normally in our communities we got to travel 20 to 15 miles out of the way in order to go and get to a grocery store, without having banks in our communities, because we don't have banks in our communities. So we have to drive at least 30 miles outside of that to go and get to a bank. Not having shopping centers that are viable shopping centers in our communities, because we're the largest consumers on this planet. So, just with those being just some factors, do you think that those are some of the things that are contributing to these situations? Because in every urban community, there's at least 15 different fast food restaurants, and you always got McDonald's, Burger King, and Wendy's there, and now you got the
Hmm.
rest.
Yeah, and if I can speak on that, Charlie, you hit the nail on the head, especially with grocery stores.
Yes.
We That's out of all those things you mentioned, grocery store, because if we're not eating properly, it leads to a whole lot of disparities, lead to a whole lot of health issues, and it starts at the grocery stores. 'Cause you're not gonna hardly ever see in a major grocery store that carrying those things that we need the most. Of course, you name the fast food chains, and uh, truth be told, that stuff is not good for us, but it tastes good, and I get it.
Mhm.
But only we gonna find corner grocery stores that's selling cold cuts and things of that nature, not fresh fruits or anything of that nature. Then the price is gonna be so high. But we don't have a whole lot of choices uh, in where we shop at. So we have to shop at those corner grocery store that's not gonna have the healthy food for us. Yes, we have to go out to banks or what have you. But the bank's probably not the biggest is because most of us don't have enough funds to have to go to the bank anyway. So, but the grocery stores are the biggest situation for us, not having a place to shop, not
Mhm.
having a place to get those things that's good for us and to help us live longer. So yes, that's the biggest issue in my mind, the grocery stores that we don't have.
So, in your opinion, how can communities collaborate more effectively to improve health outcomes?
Well, I would think we can collaborate more effectively by, first of all, helping each other become educated about what it takes, and to maybe encourage each other to saying to let them know that, hey, okay, we can come together and we can bring our own grocery store chain or lobby uh, to get those things here. And that's the biggest issue we face as a community, as a race of people. We don't do enough lobbying and making people be accountable for their representation. We give them our vote without knowing that, hey, they're gonna do their best for us. So we need to come together as a community, as one, to be able to bring those things to our community that's going to help us, not the owners the most. Of course, yes, they're in business, so they trying to get their coins, as we call it, but we got to hold them accountable. And there's power in numbers. So we got to do it as one. We can't be divided. We've always been a divided people. So we got to come together as one to lobby to get the best representation, to get the best products, to get the best or whatever we need. Even education, we got to be willing to want to get out there and get the best education, and not, I mean, I'm gonna say this, not take the easy way out, but to get the best education, not the just the easiest education, but the best.
Well, that was you came right into my next question because I want to ask you what role does education play in combating health disparities?
It plays a huge role because if you don't know, you don't know. If you don't know this is where I should go to get this taken care of, then you don't know and you're not going to get it. If you don't know that this area is a high risk area for whatever health disparities or what have you, you're not going to know. Then you're going to go there and you're going to get whatever they give you or whatever you can get. And even from knowing that, hey, I'm going somewhere where I could get hurt there, I can get medical malpractice done on me or what have you. I can get the wrong medication prescribed to me, okay, or I can have them not give me the best direction as far as what I need to do to take care of my own health. So I think that plays a huge role in it all. But bottom line, we got to come together. We got to help educate each other. We can't. We got to stop saying, well, hey, I'm gonna get mine. I don't care if you get yours. We need to come together as one uh, and make it work.
Can you speak to the importance of mental health awareness within the African American community?
Yes, of course, this being me and Mental Health Month, June, we got to number one, take care of ourselves. We got to, when I said take care of ourselves, self care, as someone in my committee always mentioned, we got to have self care. We got to be willing to take care of ourselves first. We got to not be embarrassed or be ashamed to go talk to someone about whatever issue we have in our lives. We, as a cultural a race of people, have always been saying, well, hey, we got to keep this to ourselves. We can't let someone know that little JoJo got autism or what have you. We got to be willing to reach out and ask for help. Okay, we got to leave the proud and the prideness aside and say, hey, if you can help me, what is the best way to get past this mental issue? Um, so we got to be willing to receive help. And in the past, as you well know, a race of blacks, we have never wanted to go outside our own home to ask for help from a therapist or whoever. And I'm not, again, I'm not ashamed to say I see two therapists for whatever issue I may have, and not that I'm crazy, but we have to be able to have a relief valve,
Mhm.
and talking to professionals are our relief valve. Yes, we got our pastors in the church or what have you, but I think there God put everybody here for a reason. And
Mhm.
yes, you need your pastor for your praying and what have you, but I think you need your therapist for your mental health issue. You have to be able to deal with it. You have to be able to talk to someone. You can't keep that all in to yourself, or else it will burst.
How can allies from other communities best support the Black community in health advocacy?
I think, want to or not, or trust or not, we got to trust someone else besides ourselves. I don't think this world is built for us, everybody to stay in their own little circle. Number one, we can learn from each other. Number two is that sometimes we have to go to the other communities because they got the better service. We can't just say, well, hey, I'm not sending my son to this doctor because they don't look like me. We got to decide who's got the best care and go there. Okay, we got to do what's best to be mentally stable and get the best service for our uh, own health, our own mental health. Yes, we may want to support this entity or location or this person, and that person may be good for this reason, but someone outside our own race or outside our own community may be better for separate reasons. So we got to be able to go out and reach out to get the best.
What legacy do you hope to leave in your work and in your community?
A legacy of equality, a legacy of helping each other, a legacy of wanting to see each other succeed, a legacy of making sure people are healthy, mind, body, soul. That's where I hope to leave when I finish my work here, is to leave those things.
Mhm. And what keeps you motivated in the face of challenges within public health?
What keeps me motivated, one, is being able to help people not endure what I had to endure, because I didn't know the same education wasn't out or being put out when I was coming up. Okay, that keeps me motivated first and foremost. The other thing is to be able to say, hey, I was able to help someone through a hard time, help someone uh, stay alive, help someone to be the best that they can be.
Mhm. Looking to the future, what are your aspirations for the health of Memphis's community, particularly for marginalized groups?
Easy is to help them get the best care that they can get, help them to thrive to the best of their ability. Um, and to be able to do that, first and foremost, you got to be healthy. Um, so those are some of the things that I hope to get, to assist in getting accomplished, helping people get the health care that they need. Because I think that's first and foremost priority, being able to get those health cares taken care of. Because without your health, we don't want to just be here just in body, having someone to take
Mhm.
care of us. So helping people get what they need so they can take care of themselves, mind, body, and soul.
Okay. So, in closing, what are some words of encouragement, words of wisdom that you'd like to leave with our audience? How they can connect with you via social media, your website, whatever have you? What are some of the words that you'd like to leave with the audience tonight?
Well, I would leave with the audience, as we talked about, take care of yourself, take care of your health. Uh, Self care. You can't help someone else until you have helped yourself. You got, and I'm speaking this out my mouth right now, and I'm smiling because uh, I've always tried to help others more than I help myself. So those things I would leave and encourage people to, especially know your status, know your HIV status, and just do what you can do to take care of yourself and be active.
Mm. Well, I want to thank you for spending some time with us. This has been definitely an enlightening show, and it's been really, really great along with all the others. And, we couldn't have had a better person for advocacy than yourself, because the things that you spoke of tonight were more than just enriching, but they're thought provocative to the fact that I think when people think about, especially from the medical perspective in general, when you think about that, you always think about the best. And I think with you working for the health department of Shelby County, it kind of like shed some light as to, not only are areas that you guys target to try to help to try to bring a situation around, but it also speaks to the fact that we have this issue, and it's this issue that I think is becoming more of so what we call systemic. And so when I just look at this, I mean, it's easy to say that that people are just got bad behaviors. There's just no discipline. There's no structure, and people have just gone wild. But not giving an excuse for that, I still say that when I look to what has happened to the Black community from a historical fact, is that our communities have been exploited, they have been gentrified, and they've been totally, to some extent, up to this last thread where everybody's hanging on by a thread, they're trying to die it out.
Hmm.
And so that in itself forced people to be in survival mode to even live their everyday lives. So that in itself causes you to think of survival mode, but then when those things come to light, that your health is failing, you're not educated, you don't know how to maybe read, you don't know, when it comes to getting a job, you're not qualifying for jobs because you don't have the education. But then also you're trying to take care of, as you left home, you're trying to take care of 15 folks.
Hmm.
And so with that being said, as you mentioned also earlier, that when people are in survival mode, those things don't even come to play. And so what that does is that puts you at that disadvantage, which puts you back these 15, 20 years, maybe 30 years. And some of us don't even have that long because of what our lives have been from the beginning.
Hmm.
So if we don't have the opportunities to push forward and to do what's necessary to, one, take care of your household, build your community to the point that you have others that's in your community that wants to build it, to where you can create that environment of what you want for a grocery store, what you want for a shopping store, what kind of restaurants that you want in your area, and also to keep it more convenient to put a bank in your area where you can go to that bank that knows the community. That's the way it was when you and I was coming up in yesteryear.
Right.
But see, as the world has evolved, they are trying to take more and more away from the Black community. These are things that we've got to get back to, as mentioned, because if we don't get back to that, then we're looking at still the brink of elimination. But we've got to be better, because we're in the 21st century and divide and conquer is still conquering our community.
Exactly.
It's still working in our community in the 21st century, because we got so many Black folk that say, okay, well, I just wash my hands of that because I'm just going to do what I got to do for me. But you see, when you say you go out and you want to do what you do for you, you want those same people to support you to get you. Mm-hmm. So does that make sense?
Oh, yes.
See, yeah. So what I'm saying is, why would I invest in you when you don't invest in me?
Exactly.
So if you've got nothing invested in the community, why am I going to support you? You see what I'm saying?
Sense. Oh, yes, it makes sense.
And so, when a lot of these people supposedly, quote unquote, when they get successful, they figure that they can just go and leave. They don't have to come back to the community. Oh, I know they're going to support me. But when those people call you and say, I need some help, oh, I can't help you.
Mm-hmm. That's where it should be.
And so, that's just, I don't know. It's just one of those things that, again, you helped a lot of people. I'm more than sure tonight. And again, you just added to what this platform is about, which is about community building, because we've got to get back to helping people in our communities. I'm sorry, but what these other folk do, that's irrelevant to me. Because for me, every underserved and marginalized community that has been exploited is what I target. Because I need these people to see stories just like yours, so they can be motivated and inspired to understand that there are people that look just like me that can do the things that they do, but still be a part of the community.
Mm-hmm. Exactly.
You see, that's the importance. And so I want to thank you because, truly, like I said, you've helped an enormous amount of people, but you more than personified the message that we try to amplify every show. And this is what makes me so proud to have this platform, because it's professionals like yourself that really are stinging it, but people don't know who you are and what you do. This is where now people know, especially those in the Memphis area that watch this show, that can say, I know who that is, and they can come to you for that help.
Oh, yes.
And see, that's what's important. So for those of you that are watching on the YouTube channel, if you have not yet subscribed and got all of the notifications, please do so now. We definitely would love to have your support, because as we do the work that we do the work for the people. It's not about any particular individual, it's for the people. And I welcome everyone to join this journey that we're going on, because it is definitely a quest, because our quest is to build our communities and make them what they once was. Because if we don't do it, nobody else is going to. If you look for folk outside of the community to come in and build a community, then you don't even have a prayer. You don't have a prayer, because it's not going to happen. We have to save ourselves. We have to do what we need to do for ourselves. So please tune in listen to the shows, watch the shows, give us your feedback. You can ask as many questions as you like. You will get all of the answers because this quest is one that's for the long haul. This is not short. This is the long haul. And we need to thank you, we thank you, Denford, once again. We thank everybody that was watching. And please join us again tomorrow night for another exciting show of America in Black and White, where we color conversations on America's canvas. Thank you all and have a great evening.
Thank you,
Denford.
Charles, for all you do.
Yes, sir.